Okay, scanning. Just showing you the stuff I have over here is not anything. Zeppy, come in here. Nothing on the fridge walls. Nothing. Okay, so we'll get rid of those. Okay, so just garbage. Pizza. Garbage. There's our paper that I need him to read. And there's nothing on the table. Okay, so just you can wait a minute, Heath. Okay, so let's do this. All right, you ready? Okay. Knock knock. I'm Sierra. I'll be your student nurse. Look at the kitties hiding under the Christmas tree. Knock knock. I'm Sierra. I'll be your student nurse. Pulling the curtain of privacy. Wash my hands. Putting on gloves. Are you allergic to anything? Bees? Can you tell me your name and date of birth?
June 28th.
June 28th. That's right. Okay. So you told me your name and date of birth, and you're not allergic to anything. I have a doctor's order to do a full body assessment. Would that be okay? Zeppy, come here, baby. Okay, so come here. You're all right. So don't turn nails. Okay, so the first thing I'm going to do is I'm going to assess your eyes. You wear glasses, so obviously the answer to my first question of do you wear glasses? I see you're wearing them. Have you ever had eye surgery? Yes, okay. Do you have a history of family health eye problems? No? Okay. So, first I'm going to check your eyebrows and I'm going to take these off for just a second, okay? First I'm going to check your eyebrows, your eyelids, and your eyelashes, and everything is symmetrical, and I don't see any problems. So now I'm going to check your conjunctiva, which is the red stuff, and I'm going to check this. Open your eyes. Sclera, which is the white stuff, and the sclera is nice and pink and moist, and the conjunctiva is nice and pink and moist, and the sclera is white and no yellow or redness. It looks really good. So now I'm going to check your pupils, okay? Look at Mom. So I'm going to cover this eye and check this one. Cover and check. 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 Look at Mom. Okay, look at my finger. Now look past me. Okay? Now follow my light. Checking your eye movement. All 6. Okay? And then we're going to check your field. Let me know when you see this, okay?
I see.
Okay, good job. So, now that we checked your pupils, far away, 6 points. Okay, so now I need you to read this. What does this say? Read it.
Barbie.
So, okay, so, okay, but we're making a video. We'll come up in just a minute, okay? In a minute. We gotta finish this video. Please go upstairs. Okay, so next I'm going to check your mouth, nose, and neck. So, your nose, here, let me check your nose first. Your nose is normal color, it's pink, it's normal, it's symmetrical. I don't see any issues with it. I don't see any drainage. So now I'm checking your sinuses. This is your frontal sinus and your maxillary sinus. Do you have any pain there? No? Okay, great. Zeppelin, get down. So now I'm going to check your patency of your nose. Can you go? Okay, so your nose is patent. Zeppelin, come here. It means it's open. You don't have any problems with that. So, Zeppelin, come here. Come here, baby. Oh, good heavens. Listen, we have to do this video. Okay, so, your nose is patent. Nasal cavity. Can you look at Mom? Look up. Look up. Okay, so I don't see any deviated septum. Everything looks good inside. I don't see, like I said, no drainage, no deviated septum. It is patent. Checking the egg like this with your lips, with your fingers. Checking the inside and outside of your lips. Checking your gums and your teeth. All of that looks good. Stick your tongue out and move it side to side for me. Perfect. Your tongue is pink moist. I don't see any lesions or anything, and your lips aren't bleeding, your gums aren't bleeding, your teeth aren't cracked. All that looks great. Gonna check your oropharynx and your tonsils. Can you stick your tongue out for me? Well, Okay, so normally I would take a tongue depressor, which is like a big popsicle stick. I would stick it on your tongue when you do that, and then it would make you gag a little bit, but it helps me see the back of your throat. But I don't have one of those because we're at home, not at the clinic. So I'm not able to do that. But that's how we would normally do that, is with a tongue depressor. So just like when we go to doctors. So that's checking your oropharynx and your tonsils. So now I'm going to do your lymph nodes, and I need to put you down for a minute, please. Here, come here. I know, it's okay to look at this. All right, look at me. Okay, occipitals. This is your occipitals. This is your postauricular, preauricular, submental, submandibular, superficial, anterior cervical, posterior cervical, and subclavicular. Okay, so those are your lymph nodes. Zeppelin, no. So now I'm going to palpate your trachea. Do you have any pain? No? Okay. So, since we palpated that, I'm going to just put my hands on it and ask you to swallow. Swallow for me. Okay. Perfect. So now we're going to do an assessment of your ears. Is that okay? Okay. So first I'm just going to look at them, or 3 questions. Do you have any hearing problems? No? Have you ever had ear surgery? No? Do you have anyone in your family that has a problem with, like, a history of hearing? Okay, great. So, where'd Zeppy go? Okay. All right. Just making sure he's somewhere safe. Yeah, water, that kind of stinks, don't it? Okay, so 3 questions. So I'm just going to inspect your auricles, which is your ears. So they're symmetrical. They look good. I don't see any, redness, abrasions, anything like that. So what I'm going to do is I'm just going to fold your pinna, okay? And then I'm going to push your tragus and tragus? That's this little thing right here. That's your tragus. So I'm folding the pinna, pushing the tragus, checking the mastoid process. That's this bony part back here. That's called your mastoid process. And then I'm going to, normally I'd have an otoscope in a clinic, and I would check in your ears. I would check your ear canal and your tympanic membrane. So in both ears, and I would pull this up and back. Oh, that don't hurt, silly. And I would look in check your ear canal and your tympanic membrane. And it would look like a pearly white something. And then, yeah, your tympanic membrane would look pearly white. So, the whisper test. Can you close your eyes? Okay, raise your hand on the side you hear this, okay? Good job. Come here, Zeppelin. Okay. Okay. So next we need to do your integumentary and musculoskeletal. So your skin is pink, dry, and warm. It's intact. Your skin turgor is good. Don't lick me. Doesn't show any signs of dehydration. Your nails are pink and clear, and your skin is intact. I don't see any signs of clubbing. Like I said, your tissue on your nails is good. So good. You don't chew. That's good. I don't have any issues with that. So next I'm going to check your capillary refill, which is less than 3 seconds. Checking it on your toes. Checking your legs for edema, and I don't see any signs of edema. If I were, it would be 1, 2, 3, 4, 2, 4, 6, 8. That's okay. Checking your arms and legs for any signs of phlebitis, which is redness, warmth, and pain. Are you having any pain? Okay, color looks good. Put your hands out like this. Straight out. So checking for tremors, tremors, fasciculations, and contractures. So that's that. And I don't see any of that would be like, deformed hands, shakiness, anything like that. And you don't have any of that, so that's good. Just going to palpate your joints. Let me know if anything hurts. Checking for redness, swelling, and pain. Okay, so then now we're going to do your, range of motion. So put your head into my hand. Put your head into my hand. Okay, so I'm checking your sternocleidomastoid mastoid. Push your shoulders up. Okay, that's your trapezius. Put your arms out. Okay, put your arms out. Like this. Push up. Push down. Okay, that's your deltoid. So now give me your arms. Both arms. Like this. Okay, pull. Okay, bicep, push. Check, push. Against my hands? No, like this. Put your hands. Give me your hands. Okay, push. Tricep. Okay. Now hold your fingers apart. And don't let me squeeze them together. Checking your fingers. And then push. Push with your wrist. Push with your wrist. Yep. Push. Okay, whatever. We're checking your hands and wrist muscles. Push your legs together. Push your legs apart. So adduction and abduction. Push your feet up. Push your feet down. Checking your feet and ankles. Pull your legs towards you. Pull them towards you. Push them. Push away. Okay. Checking your bicep and triceps. You need to be nice to the dog. Okay, so now that we did your range of motion, we're going to check your spine. I need you to stand up for me, baby. Okay, so I'm checking for any signs of kyphosis, which is curvature of the upper, scoliosis, which is an S-curve of the whole spine, and lordosis, which is the lower back. Gonna have you walk to the bookshelf and back. And your gait and stride and everything looks great. I don't see any issues with that. That's okay, you can sit right there. And then stand up and put your hands to your side. Just checking and close your eyes. Stand up nice and tall, hands to your side, eyes closed. Okay, and that's your Romberg's test, and you're not swaying or anything, so that means everything's good. You can have a seat back on the end of the chair. Be careful with Trixie, please. So now we did the Romberg test. Your level, be nice to the puppy. Your level of consciousness is good because you were able to tell me your name, date of birth, allergies, and answer all your health questions. So that's all good. Next we are going to do your nerves. So let me grab this here. Okay, can you smell this? Or close your eyes. I'm doing this backwards. Close your eyes. Smell. What is it? Candle. Okay, so that is your olfactory nerve. It affects or helps you smell. It is your smell nerve. And then your optic nerve, we assessed when we did the I Love Barney paper. And your, let's see, on occasion our trusty truck acts when a good vehicle anyhow. So, sight, ocular motor, trochlear, and abducens are all eye movement. We assessed those when we did the 6 movements. No, leave his glasses on. Your trigeminal is your sensory. So close your eyes. What am I touching? What am I touching? Okay, so that's your trigeminal nerve. That's sensory. So then your facial. Look at mom. Smile. Okay, so that's your facial nerves. Vestibulocochlear was your hearing when we did the whisper test. Glossopharyngeal would be when I put the tongue depressor in your throat and asked you to say ah, like ah when you gag. The glossopharyngeal is the gag reflex. The vagus is when you say ah. Can you say ah? Ah. Okay, so that's your vagus nerve. So then, can you shrug your shoulders? That's your accessory muscles. And then your hypoglossal is when you stick your tongue out and move it side to side. Okay. So that's your hypoglossal.
Dad.
Yes, Daddy just got home. That's okay. Go get him. So now I'm going to do the Babinski test.
Dad.
I think that's next. Okay, so give me your foot.
Dad.
Okay, Babinski. So let's just, you take like a sharp object, like a pen or something, and go, does that tickle? Around the circle of their foot. That does tickle, doesn't it? So then, now I need you to do the fingernail test. Can you put your hands together like this? Here, give me the dog, honey. You can hold it when we're done. Here, like this, with your arms out. Okay, hand over, finger to nose, finger to nose. Okay, can you go like this? Finger to thumb. Good job. High five. Okay, Zeppelin, you're gonna get hurt. Go get him if you want him. You're gonna get hurt. Come here. Go get him. Go get him.
But Trixie won't let me grab her.
That's okay. We can hold Trixie in a minute. Yeah, Daddy just got home. Go get him. Okay, so next we're going to do, you're okay. I can't think straight. Okay, respiratory. No, don't do that. You're irritating him. Come here. So do you want to help me? Here, do you want to help me? Here. Want to help me? So we're going to do the respiratory assessment. Okay, Heath, do you have any problems breathing? Have you ever had any lung surgeries? Are you on any medications for your lungs? Okay, so there's your 3 questions. So what we're going to do first is we're going to check your 2-to-1 ratio of your thorax, and I don't see any barrel chest. So that's good. And then we're going to check you for lordosis, scoliosis, and kyphosis.
Mommy, I can't play.
But we already did that. So we already checked you for kyphosis, lordosis, and scoliosis. So there are no abnormalities. Oh my goodness! Listen, we'll be up in a minute. We're trying to finish this. So you're breathing effortlessly. I need to palpate. Look up, honey. You need to palpate your anterior and posterior thorax, checking for any crepitus, and I don't feel any of that. Oh my goodness. We're going to, let's not shine that in our faces. Lean forward. We got to check your chest excursion. Heath, John, Michael, sit up. Take a deep breath. Okay, take a deep breath. Take a deep breath. Okay. So when you breathed in, my hands remain symmetrical. So that is what we're looking for. I need to listen to your front and back of your lungs. So I need to go under your shirt for this. And I would ask you to breathe through your mouth, but I'm not really going to have you do it because you're little and whatever. On the side. On the side. All right, we're going to check, listen to the back.
I did not find it.
And I would ask you to take a deep breath on every new spot. I'm checking the side. Okay, so then everything is bilaterally. I hear everything the same. There's no abnormalities. Everything sounds great. I need to, oh my goodness, they're so loud. Okay, ready? Look at Mom. Look up. I need to listen to your trachea, so I just need you to take a deep breath. Look, sit up. Head up. Take a deep breath. Breathe. Okay. So listening to your trachea. So then now I need to do your cardio assessment. Do you have any heart problems? Have you ever had heart surgery? Do you take any heart medications?
No.
Okay. So I need to assess you for jugular vein distension. We would do that lying down, and if you did have any, I would raise your head 45 degrees and reassess you. Don't shine that in people's faces, please. So I'm looking at your pericardium for any pulsations. I don't see any pulsations. So then I would palpate. I would palpate for any crepitus. So I'm trying to think what's next. Listen to the carotids. one at a time. I would ask you to hold your breath so I could listen properly to the blood flow. So now I'm going to listen to your aorta or your aortic through here. Chin up, please. Aortic, pulmonic, Erb's point, tricuspid, and mitral. And lower would be your S1, upper would be your S2. Hi, Austin. Zeppelin, why don't you go see Austin? He just got home.
7 hearts.
So, now I would do the, pulses. So, look, honey, listen. Temporal, carotid, brachial, radial, femoral, popliteal, your feet, please. Dorsalis pedis, posterior tibial. Yes, go see Austin. Austin, can you call your brother, please, for a minute? So I assessed them all bilaterally. They're the same. They're equal. They sound fine. Now we're going to come over here and we're going to do your abdominal assessment. Yeah, come on.
Switch camera round. Around. I don't have
Okay, I fixed it. All right, lay down, please, with your head here. Lay down, please. Okay, did you go to the bathroom before we did this assessment? Yes, okay, great. I'm going to ask you to bend your legs a little bit, just to make you a little more comfortable. I'm checking your abdomen for size, symmetry, and contour. Is this how it normally looks? Yes, okay, everything looks symmetrical. Put your chin to your chest. Checking for any hernias or distension, and I don't see any of that. It looks great. I know it tickles. So now I'm going to listen to your bowel sounds. 15 seconds. Honey, come on. 15 seconds each quadrant. I'd listen for 15 seconds for all 4 quadrants. If they're hyperactive, so that's great. If I didn't hear anything, I would listen to each one for 5 minutes. Next, I would listen with the diaphragm to your bowels. Then next I would listen to your arteries, and I would listen with the bell side. And I would listen to your aorta, which is in the top center. Then, stop. Renal, iliac, and your femorals down here. And again, I listen to that with the bell side. So then, after I listen to your arteries, I would percuss all 4 quadrants. So, stop. Come on, buddy. I just want to get this done. So, I would percuss all 4 quadrants. And then, obviously, since he's ticklish, apparently, all of a sudden, he never used to be, but now it's funny. So, I would take his hand, and we would palpate his 4 quadrants and slowly, gradually remove his hand, and I would continue to palpate. Okay, so, palpate all 4 quadrants. Oh, and I would go 1 to 2 centimeters deep while I'm palpating, and like I said, to check jugular vein distension, he would be lying down flat, and if I saw any, I would raise it 45 degrees and then reassess it. Is there anything else I can get for you? I have the time. Okay, I'm done.